Hello and welcome to Reportage. This is Danish bin Nabi. In today's segment of Reportage, I am joined by Mr. Joseph Chalil, which has recently released the book India Beyond Pandemic, which is published by Konark Publications. It talks in detail about the two COVID years which India had gone through and how basically the government tried to save its people. Mr. Joseph, as far as this new book is concerned, it entirely deals with the two COVID years, which India, not only India, the entire humanity, the entire global has gone through. I just want to understand from you, as you have put in a lot of research in this book, do you think that India handled the two COVID years well?
Um, Good evening. And again, I can't say any country did very well in managing COVID. So, this is something new. This was something unprecedented. This was something none of the current doctors, nor the administrators, nor the prime ministers or presidents were experienced in handling. So this is not something they were prepared for, nor they ever dreamed about, how it's going to work out. Uncertainty was all over. They did not know, what's going to cure it. How does the patient die? We don't know how the virus was killing patients, and how do we prevent it? We had no vaccines, no treatments. So the short answer to your question is no. No country did well, including India. But the silver lining is that what did we do once we were managing it? Once what we learned from it, or did we come out better than rest of the world? I would say yes.
But how do you see things when you saw that the Indians, they were asked none other by the Prime Minister to beat the utensils at 9 in the evening? None of the countries except India did so for the treatment of COVID. Was it necessary?
No, again, I think
No, first, was it necessary is something different. Was it scientific to do? Did we fool ourselves by doing so? Because if I remember correctly, India was the only country, ours was the only country which did a foolish act by saying that beat the utensils at 9 in the evening.
You could ask a similar question to the Americans, when New York nurses' shift was ending, people are opening their windows and clapping hands at that time of 8 p.m. or 7 a.m.
Which
In
is
New York.
which is entirely different what we did in India.
Correct. So
Italians came out on their balconies and started to sing, which is again entirely different what we have done in India. Was it scientific?
There is no scientific basis of either banging utensils or making ringing bells, but there is a mental aspect or psychological aspect of keeping the country together, because when we don't know what to do, you go to a temple and you
No,
ring bell.
if I remember correctly, our prime minister explicitly said that it will create something in the air by which this virus can go. So there is a difference what we
No
have done,
scientific.
what Italians did, and what Americans did.
I don't know exactly what was transpired in what was communicated to the
Because
population.
when I was reading your book, I was looking for answers to such questions. Was it scientific to do so?
There is no scientific basis for any of those activities. I mean, we didn't know, even some of the masks we wearing, was it scientific? Even some of the treatments we were giving patients, was it scientific? So the good thing about science is we don't know what we don't know. These are unprecedented times. The treatments were unknown. How does virus, people were telling people, oh yeah, you have to drink hot water and hot coffee and steam inhalations in China. Was that working? No. So everybody made mistakes. That's what I'm saying. India is not unique. We didn't do anything. China, on the other hand, was locking up doors with wooden plats. The apartment complexes were locked out. People died inside. So
Yes,
was it
they
scientific?
died inside, but they did not tell their people that this will cure the COVID, the
No,
virus.
they killed the
On
patients
the
without killing.
on the other hand, from our highest government authorities, they were telling us do this and it will cure it.
Again, I don't know. I mean, there was also communications from
So
multiple
my
states.
simple question, my simple observation is very simple. That on the one hand, there is a government who says do these silly things and it will cure it, and on the other, do they are putting behind log them behind doors, but they are not telling that it will cure it. A repression is a different thing. Fooling your people is a different thing. Don't you think we have fooled our people?
That's what I'm trying to confirm is that, was it communicated as a scientific message from the physicians of the country?
Absolutely,
Was it coming
absolutely.
from
It
the
was done
AIMS
by the prime
director?
minister, none other than the prime minister, who said that it's
Uh,
going to cure the pandemic.
there is no scientific basis for such thoughts. Same thing. What I
So
would
you
say is
agree
that
with me that we were fooling people?
when there is a different argument to be made. What I'm trying to say is when there is no action which can cure, which can give people confidence, you have to create something which can bring people together. So
Mr.
there might be
Joseph,
an argument
coming
to be
back
made,
to
but
your
there's no
book,
scientific basis.
Mr. Joseph, coming back to your book, you have written the book. It's just like reading the newspaper in the morning, like we do. Why haven't you done research on these things if you were writing on COVID?
The purpose of the book was not about, how did India, did day to day on COVID. This is not
But the
a
book
treatment.
is on India.
Correct. This book is not on India, on what happened while the COVID was progressing, not what happened on day one, who made a mistake. Like for example, India was advising patients on, Ayurvedic treatments for COVID. Do we have scientific proof? Was it working? I don't know. We were advising patients to take homeopathic medications for COVID. Do we know that was working? We were, even in America, we were giving patients ivermectin and malaria medications for COVID. Is there proof? Is it working? No. So, and then on the top of it, we have the president of the US, the prime minister of UK, the prime minister of Canada, many of the European prime ministers all got sick with COVID after all these scientific researchers done all over the world with billions and billions of dollars protecting them, from, distancing everybody who went into White House. I've been visiting White House at least 3-4 times during that time. And I clearly remember we need to show multiple COVID tests to get into the White House, like 3 days before, 1 week before, even the day of the test. And even after all those precautions, the president of the US got COVID multiple times and he got sick, right? Whether it is President Trump or President Biden. And then, the Canadian prime minister was sick with COVID. Even the Indian president was sick with COVID. I was told that higher authorities in India was also sick with COVID, undisclosed. They never informed us that the prime minister ever had COVID or not. So I don't know that's true or not. But the fact remains, not everybody did what every country, every leader did was scientific, because there was no science behind it. We didn't know the science. Science was not done. This is something new. This was something unprecedented. This was something which we were not prepared for. So again, while you can say that, ringing a bell in a temple gonna cure your prayers, it's your belief. I'm not a believer in it, but some people believe in it. So there is always a psychosomatic effect to every disease.
My simple observation and my simple thing that I'm trying to ask you is that in the other countries, it did not come from the ringing the bell. Did it come from the government that you ring the bell in America? Correct me if I'm wrong.
It did.
It did.
Yeah. In fact, we had a COVID task force. So president and the chief doctor of the country were addressing the patients or the population every day on the media, and they were advising people on what to do, from unscientific medical treatments to distancing from patients, what need to be done with masking. Initially they said, masks shouldn't be used. It should be only used if you are a doctor. Then, they changed it to say that everyone should wear a mask. While in China, people were insisting that it has to be N94. In reality, every other mask, other than a highly effective N94 mask, that to put on a patient with a seal-proof, is the only way to work. And even if you have, even if you haven't shaved that day, have few beard on your face, the mask doesn't work because it's going to leak through the side of it. So these are scientific reasons, and what we propose when we
Mr.
don't have a
Mr.
scientific.
Joseph, Mr. Joseph, given all the pandemics, given all it had, this
Mhm.
virus, this COVID-19, simple question to you: could we have handled it very differently?
Oh, definitely. Second time around, everybody will know what to do. But that we call in America as, Monday night quarterbacking. So we know what happened. Like, for example, elections happen in India, right? Every party will now come in and say, I would have done this better. I could have done that better. And we would have, won every seat in the country. Same thing here in every disease state. If we know how we were treating, malaria, 50 years ago, if we knew how we would treat typhoid 50 years ago, if we knew how we would handle diabetes or hypertension or even cholera epidemic, decades ago, or even the flu pandemic, in from 1979. So hindsight is 2020. Yes, going forward, we know what happens. We know what to do. People are not afraid of COVID anymore. People are still getting sick with COVID, but they're not being afraid. Now we know that the side effects of the disease. We know the side effects of the medicines. People are, there are drugs approved, but we didn't have it. We were told that if you get vaccines, we're gonna be fine. Are we fine after getting vaccines? No, people still got sick.
Mr. Joseph, one more thing which I observed from your book after reading your book, that you haven't mentioned about deaths. Did we lie to our people? Did our government lie to the people?
I
Please
would
be,
say yes.
please be specific to the India only.
I
Do
would say
not
yes.
give me examples of the other country because I'm completely concerned with my country, that's India.
I would say yes.
And you believe that our government lied to us about the deaths.
Or they didn't have the right data available to mention. Because, for example, I'm from Kerala in India, right, originally. And I've seen how Kerala reported the deaths early on as if the least death in the country in India. And then they revised those numbers later because it was basically, how would you call death? What would you call as a cause of death? Is it, if COVID is written in the post-mortem report or in the doctor's death certificate versus the patient died of a heart attack, post-COVID. Maybe the patient died of a stroke from COVID. Maybe the patient, was old and we don't know what happened. They just died and they just put it as something else. Then they readjusted those, because when we can find out that the normal death rates of a year was happening and during the COVID years, it went up remarkably. So it is much, much higher. And then every state, even US, readjusted that death rates. I mean, even if you calculate deaths in US versus India, again, I don't know if India had the accurate calculation of every death which happened in a rural village. Same thing in the US. At least here, there was I would say, calculation of death because the government came in initially and said anyone who dies of COVID, their hospital bills will be paid by the government. So every private hospital, what they did, every death which has started happening became a COVID death because it's easy to classify as a COVID death. No one's going to question why they call it a COVID death because your bills get paid by somebody. India did not have something like that. So hospitals were not incentivized to call everything a COVID death. But then, patients were started giving, there's some sort of a funding or financial reimbursement for deaths of COVID, and states were reimbursed money from the central. Then they started readjusting. So I truly, I don't know. I think the real numbers are much, much higher than what we know.
Not only with the deaths, but with the laborers too, especially the migrant laborers. Did we handle that well during those two COVID years?
No, I would say the first 2 years, India wasn't prepared. I believe our administration thought this is going to be a short-lived, incident where, everything will be fine in a few months. They did not plan for a multi-year, lockdown or, loss of work for people. It wasn't nice. People walking, from Delhi to UP or from, long distance and
But
dying
why
on the way.
aren't all these details in your book? Why
But
are
because
these such details missing from your book?
the purpose of the book was not about how each country handled. That's more of a forensic analysis. This is more of a vision document of what went, what went right, what
But
lessons we learned from it.
a vision document, as you refer to this book, cannot be done without looking on all the aspects of the COVID. Deaths are important for that vision documents. How did we treat our poor? How did we treat our migrant class? How did we treat our laborers? Is a must for that vision document.
The,
Don't
the
you think
point
so?
here, the point here is not about the forensic analysis of what happened. The point was, how do we prevent this from happening again? What can we do better?
But if this is a vision document and there are no details about death, there are no details about laborers, there are no details about the hungry people which have gone by all those days, how can we, if the pandemic or any disaster again struck us, how can we be prepared for all those things?
Remember, this happened everywhere else in the world. This was a disaster where with
Mr.
unprecedented.
Joseph, Mr. Joseph, I am again repeating myself. Please be specific to India. I have no concern with the rest of the world. I'm only concerned with my country, with my people. You call this a vision document, but you haven't put all those details. How can we handle any such disaster next time? When in your vision document, we don't have such details. How can we prepare ourselves? How can we prepare the people?
Danish, I think one thing which needed to worry about or think about, you've been saying that I'm only worried about my country. That exactly the problem is. Pandemic wasn't a country-specific pandemic. This
But this
wasn't,
book is specific to
it
India.
is, it is, but it
This
didn't.
vision document is
I
for India,
understand,
not for the
but you believe,
America, not for the US, not for the Europeans.
but
This
you
is for my
believe,
fellow countrymen, right?
but you believe that COVID came from India.
So hold on a second, Mr. Joseph. Kindly hold on for a second. You call this a vision document. This vision document is for India, or is this for the rest of the world?
For the rest of the world.
Not for the India.
Rest of the world, including India. So what can India
Including
do?
India.
Where does including
If
India?
it's including India, then deaths, hunger strike, laborers, why is that missing?
Again, the we have limited number of pages in the book. There, if you can go details into every story which happened from the
No,
day
you are
one, it
absolutely
is
wrong.
not.
You
I'm
could have
not
made
sure.
this book 500-600 page book. There was no need to stop at 200 pages.
I agree. I'm not saying this is a perfect book with every details happened in India. With the limited availability of resources we have, what we were able to, the plan was, or the thought was, what did India do? What did the world do? How does India compare to the world? This is not India comparing to itself. This is not the exam on how did Prime Minister Modi or his government or each state chief ministers or their respected fellow doctors did that, or how did Niti Aayog manage it. No, that wasn't the whole intention. Is that they managed the way they did. Did they do a perfect job? No, they made mistakes. But compared to the rest of the world, how did India perform outside? Like, once the pandemic is over, did we come out better? Is the world better off with India in it? If India wasn't there, would the world has been was worse off? Number two, if there is another pandemic, is any country ready? I don't think any country is ready, including India. So the whole plan was, how do we, because the pandemic is not isolated into just actions of few people. It is about, the same stuff could happen if there is a war. Imagine if there's a war with Pakistan or China, or there's a world war going on. The same thing could happen. India will be still be short of supplies. We were dependent on China for everything from masks to PPE kits to products, from cell phones to whatever. India is weaning itself off from China. It wasn't just the India problem. US is dependent on China. I remember I was in China in 99 during the initial months of COVID. I didn't know that the COVID was happening, but I knew there was news reports from Wuhan that they were mandating that people has to wear N95 mask on the street. If not, they would get arrested. And I was surprised. Why why they were forcing normal people to wear N95 mask for going for grocery shopping, if not get arrested. But it wasn't reported in any international media. And when I was in China, I ordered on Amazon a box of N95 mask to my house in the US. And when I came in back to US, it was here. I didn't think about it, but then 3 or 4 months later, we start getting, patients getting sick and doctors, not having enough N95 mask in their hospitals. Another thing which they did was they even start buying up all the supplies, Chinese companies or Chinese governments that were not available. Like, for example, the ventilator companies were sold out because Chinese companies kind of pre-ordered what they wanted, what they were making. So their entire supply inventory was getting depleted. And this was the same thing. Well, they stopped shipping masks, they stopped shipping N95 masks and the PPE kits, the gloves, syringes, simple things which we take it for granted every day, wasn't there.
Mr. Joseph, our vaccine for COVID. Now the reports say that it's because of these vaccines this heart attacks are taking place. What are your views on it?
I would agree with that finding.
And we have supplied vaccines to almost every country, if I'm not wrong.
But the heart attacks were as a reason of most likely because of the American vaccines, more likely because
not because of our vaccines.
I haven't seen reports of Indian vaccines causing heart attacks. What has happened, what come out in the light was that the Moderna vaccine and the Pfizer vaccine, especially the mRNA vaccines, which were untested for, has higher incidence of blood clots. So I do have personal incidences and friends and family who suffered from it. So I'm not disputing that fact. I don't know exactly, these vaccines came out to the world too soon without testing. But the question remains, did we save life by giving vaccines?
Did our vaccine also came too soon? Without properly,
I would say all vaccine. I think the speed at which they could bring the vaccine trumped any scientific research time we normally take a vaccine to bring out. So this was brought up too soon. But the point was people were dying from COVID. So they had to stop the spread, even though the side effects were there for especially patients, elderly, and one thing which I think we don't
Mr. Joseph, one of the WHO reports, World Health Organization report, said that around above 40 lakh people have died in India. Do you agree with that report?
Again, I don't know the exact numbers, so I'm not gonna dispute any WHO numbers, how they came in from. So as I said, the numbers were not accurate in any country. I would say the real losses of COVID is much, much larger than all of us can compile, whether it is in India or US or Germany or UK. But exact numbers, how does WHO know, right? Do they have the death certificates of people? No, what they do is statistical analysis of how many people died in the past, let's say 10 years versus what happened in the COVID years. And they can say, these people might have.
So, Mr. Joseph, in other words, you're not agreeing with the WHO figures.
I'm not disagreeing with the WHO figure. I just don't know. I can't confirm it. I'm not agreeing because I don't know. I don't have the data to prove that this is the correct.
So be very direct. You agree with the WHO figures or you don't?
I do not know. I would rather be honest and say I have no data to confirm the WHO figure, whether this might be done statistically. So we can say that like 1,000 people died in one city in Mumbai, for every day for the past 10 years, and suddenly Mumbai saw 10,000 deaths during COVID years.
Mr. Joseph, again, you call your book a vision document. But India, as you know, is spending far too less on two important aspects of society. One is education, the other one is health. You haven't again mentioned how much should we spend on the health by cutting down on our defenses or on any other sector.
I would agree with that statement. I would say 100%. India need to spend a lot more on healthcare. So right now, India spends maybe 0.2% or 0.4%
Mr. Joseph, sorry for cutting you down. If I'm not wrong, you must be in contact with certain people as far as the administration is concerned. Have you put forward all these recommendations that we should invest more on health?
I've been writing op-eds on Sunday Guardian for the past 2 years, and at least I can say at least there are two op-eds written on this, that India should be investing in primary care. India's GDP percentage to investment. In fact, I wrote to Ms. Nirmala Sitharaman before the budget as well, that a investment in healthcare need to be increased to multifold. Current data is not enough, so primary care need to be primary PHCs. I think that the backbone of Indian healthcare system is the government medical colleges, the district hospitals, the primary health centers. Those need to be upgraded, need to be revamped. Whether we do private-public partnerships, that's where investment is needed. Because what happened during COVID is that since there was, inadequate supply or inadequate treatment given during, at the village level, people thought, if they come to big cities like Delhi or Mumbai or Bangalore, they're going to be saved. And these people were stuck in a taxi car or bullock carts, dying because of lack of oxygen. So this could have been prevented. This shouldn't have happened. But this happened all over the world as well. This happened in Spain. This happened in UK. But the question is, are we better off than we
Mr.
were?
Joseph, point well taken. Now let's move forward and ask me you some few more questions. Do you think we have utterly failed as far as the health infrastructure is concerned? Because if you go to Uttar Pradesh, if you go to Bihar, situation is completely dismal there as far as the health sector is concerned. Have we failed our people?
So that also a question coming in from what was there before and how are we doing it now? So, has things changed in the past 10 years versus past, 40 years, 50 years?
I'm not talking of last 10 years. I'm talking of last 75 years.
I could say that India has one of the worst, actually public health infrastructure, which we went, but again, I've also written, op-eds on this as well. In this aspect, I have compared the built-up of infrastructure in the US compared to India, and I can clearly say, when US has been stagnant for the past 15, 20 years in not a single medical school, or very minimal medical schools, many minimal hospital being built, many very minimal doctors being trained. India has tripled, quadrupled their output of physicians, their efficiency in clinical and hospitals. But is that enough to manage a largest population of the world? Maybe not. But when I look at, as a physician coming from India, working in the US, managing now a large American company with multiple hundreds of clinics, I can clearly say the difference in healthcare infrastructure improvement over the years. Do you know why patients died in the US? We don't have any private public hospitals. If you don't have insurance, if you don't have, an average treatment in the US for a COVID treatment was around $40,000. $40,000 is, 32 lakhs
It's a
rupees.
lot of money. Yeah, I understand. Mr. Joseph, quick 2 points. My last question to you. Give me 2 quick points for the healthcare which we can upgrade our healthcare. 2 quick points which we need to take into consideration.
I would say individual responsibility of patients to monitor themselves, take a healthier life. So, eat right, exercise. Nothing trumps, no medicine will cure every disease of lifestyle if you cannot get your life straight. If you do not eat right, if you don't have a good, workout ethics, and then you keep peace in your mind. And then, yes, one thing I would say, the last and main point I would recommend for every Indian to do would be to get an annual physical exam, a well visit. Like, go to a doctor once a year, get a checkup done. I've been pushing in this book, as well as in my op-eds in the past, was that India should be promoting well visits, annual physical exams to our patients coming in, so that we can prevent diseases from happening. We can find out if they are diabetic early on, if they have hypertension, if they are cancers. We can identify them and prevent it or treat it early on, versus finding a breast cancer on fourth stage when it's too late to cure them. when we finding out that the patient had diabetes and have nerve damage, that's too late to fix them. So back to the basics again. Primary prevention is always better than cure. Living a healthier life is better than getting treated.
Mr.
COVID or no
Joseph,
COVID.
Mr. Joseph, pleasure talking to you. Let me hold your book once again for the audience so it reaches maximum viewers. They
Thank you
buy
so
it
much.
and read it. Pleasure talking to you. Thank you.
Thank you so much for having me.
Please subscribe to our channel Reportage and press the bell icon to remain updated.